Okay, can everyone see the screen okay?
Yes.
Yes. Okay, so today the presentation is going to be about the medications used to treat COVID-19. And by the end of this training, you'll be able to identify the types of medicines that we have available for COVID treatment and identify who's eligible and how you are able to access these medications. So some important information about these medications is that there's no cost for these medications. Of course, if you go to, say, your doctor or such, there might be a cost for just diagnostics, but the medication themselves are covered by the government. So Medicare and Medicaid do all cover this. And if you were to access them through DPH, so public health, then they are free of charge. And these medications are only to be prescribed. So they have to be prescribed by either a healthcare provider or a pharmacist. And they are not a substitute for getting the COVID vaccine. So we do highly suggest that everyone does get vaccinated. This is only for those who still get COVID. So I'll go over how you will qualify for them. So there's 3 medications that are currently being used to treat COVID-19. In order, they're going to be Paxlovid, Molnupiravir, and Remdesivir, and these are all prescription medications. And what these medications do is that they are antiviral.
For a second. Your screen freeze on the second page.
Oh, okay. Okay. What is it on now?
It's still on the second page, on the objective part.
Okay.
It's working now.
Okay. So let me go back a little bit. Is it working?
The current page is MOL.
Okay, let me go back. Let me see. Okay, sorry about that. Is it on the Paxlovid slide right now?
Yes.
Okay, so Paxlovid is the most commonly given medication right now. So this is the one that's most likely to be prescribed. And this is for people who are 12 years of age and older and weigh at least 80 pounds. This is an oral medication. So it's a pill that you take twice a day for 5 days and should be started within 5 days of developing symptoms. And then for this, you get prescribed from either a form. It'll be your doctor will write a prescription, so the pharmacist will be able to provide this to you. And then the second medication that we have is Molnupiravir. This is for adults 18 and over, and this is not recommended during pregnancy, and it also has a lot more side effects than the previous medication. It's also a pill that you take orally twice a day and within 5 days of developing symptoms. And finally, the third medication is Remdesivir. This is an IV medication, so this is why it isn't as commonly used. And this should be started within 7 days. And for adults and children weighing over 7 pounds, and it's given once a day for 3 days. But you do need to be hospitalized for this medication. So people who are eligible for treatment are those who are age 50 and older, or either unvaccinated or not up to date with vaccinations, and they have specific medical conditions that make them more likely to develop severe COVID symptoms. And some examples would be cancer, smoking, heart conditions, also diabetes, dementia, and so on. So in order to get the medication for treatment, you have to be tested positive. Even if you have any mild side effects, we still need the positive test. And if you wait too long, you might not be eligible. So if you want to get access to these medications, you have to let your provider know as soon as possible. So there's a few different ways to get medication to treat COVID. So the first one would be, of course, contacting your doctor and having them evaluate you and having them write a prescription for you. Another is to use one of our public health test to treat programs. And I'll go over that a little bit more later. And if you don't have a doctor or unable to drive to a test to treat program, then you can always call the public health telehealth service. And these are open 7 days a week from 8 a.m. to 8:30 p.m. And the phone number is on the screen. It is 833-540-0473. So this is information about the Test to Treat COVID program. So for this, public health has collaborated with various community health centers as well as some pharmacies, such as CVS. And at these locations, they have they are ready to they have COVID tests, so they're able to test you to see if you're positive, and they're able to prescribe the treatment at the same time. So they do have their own allotment of treatments, and this is going to be for the treatments that, of course, are in pill form. And this is how you can get access to these medications. So once again, you can always visit our website or call our number, which is on the screen right now. And then the telehealth service as well, if you're unable to drive to one of these test to treat locations, you can always call the public health telehealth line, and there'll be a doctor on the line to be able to diagnose you, and we can mail the prescription to your home. And then just so this is pretty much the end of our presentation. So we have a few questions, of course. So if you test positive for COVID and you have symptoms, should you ask for medication right away, true or false? So yes, the answer is true. You want to get access to these medications as soon as you can. So as soon as you test positive, you should contact your provider to get the resources needed to take these medications. And then if you get, how do you get COVID-19 medication? Should you contact your doctor, visit a test to treat location, or use a telehealth service? Yes, and the answer is D, all of the above. These are all various ways that you can access the COVID-19 medication. And then here's some further resources. If you or anyone you know need further assistance in acquiring medications, you can always visit our website at phlacounty.gov/COVID-medicine. And if you need to get a COVID test, you can always access our COVID tests on our website as well, and we'll be able to mail some to your home. And now this concludes the presentation portion of this segment. So now we could go on to the questions.
I have someone send in the question. So The first question is there any known side effect for medication?
Yes, there are side effects to the medication, and that's why we do encourage that everyone get vaccinated, because that is the best way to protect against COVID. But the medication is just to prevent further severe symptoms of COVID. So once again, that's why Paxlovid is the most commonly given one. The symptoms of that aren't as severe or not enough that there's a lot of data backing up showing that there are different side effects. But the second medication, the molnupiravir, that one is shown to have birth defects. So that's why it's not as rarely given. So for that one, you need to not be taking any other medications, and you should not be pregnant while being on that medication. Does that answer the question?
Yes. So someone in the chat types, is this available for people without legal immigration status? Is telehealth service available in other languages?
Yes. So for telehealth, we don't ask any immigration status or anything like that. We don't. This is public health, so of course we try to help everyone in the community. So, and we do have access in other languages as well.
What are the most, well, what are the languages that covers? And Spanish, Mandarins, and
I don't have a list of all the languages, but off the top of my head, I know that it does cover Mandarin, Vietnamese, Spanish, but there's a whole list on that.
Okay.
Yeah.
I have a second question. How long does it take to get the medication?
It depends on how soon you're able to get the prescription. So the first thing is, of course, you have to talk to a medical professional, and they will be able to write the prescription. So at that point, it's kind of dependent on which route you are taking. So if you're going to, so it could be very fast. If you go to a pharmacy that has the medication in stock, you could get it that same day. Of course, if it's being mailed to you, that might take a few days. But for these medications, they do need to be received. It's really dependent on how fast you go to the provider in the first place.
I got one more question. I think this might be the last one. How long should they take the medication?
So the provider or the pharmacist will have, they will be able to let the patient know how long, but yeah, let me check really quick. So these medications, they're taken twice a day for 5 days.
All of them, or just
Yeah, the two medications that are in pill forms, they're taken twice a day for 5 days, with the third medication being the IV treatment, in which the patient is in the hospital, and that's given once a day for 3 days.